Hi, my name is Oluwafeyikemi and I'm a registered nurse. This month, we're going to be talking about breast cancer. And discussing breast cancer here with me is a medical doctor, Dr. Tife. Welcome, Dr. Tife.
Thank
Please
you.
run through what breast cancer is.
Okay, so breast cancer is a malignancy of the breast tissue. It could be of the ducts or of the lobules. That's the part that produce milk in the breast. And breast cancer is the most common cause of cancer in women and the second leading cause of cancer-related deaths in women. When men and women can be diagnosed with breast cancer, although fewer men have been diagnosed with breast cancer than women, so it occurs more in women than in men.
Thank you very much. So we've heard that certain cosmetic products or undergarments or certain activities that some women do predispose them to having breast cancer. Can you help us with the risk factors of breast cancer?
Okay. So there are some myths that wearing tight-fitted bras cause breast cancer, using certain antiperspirant or deodorant causes breast cancer. However, there is no scientific data to conclude or to back this myths saying that they cause breast cancer. Yes, some risk factors have been identified with breast cancer, like age. Breast cancer is diagnosed more in older women. That is, the risk of having breast cancer is more with increasing age. So as a woman grows older, she can develop breast cancer. There are other risk factors like family history. If there's someone in the family that has had breast cancer before, there's a chance that the older women in the family can also develop breast cancer. There are other things like genetic mutations, like if depending on what people have been exposed to radiation or maybe use of oral contraceptives and all of that. And also lifestyle is important in the diagnosis of breast cancer. Some lifestyle factors like obesity, smoking have been associated with the development of breast cancer in women.
Okay. So simply put, can you tell us how breast cancer is diagnosed?
Okay, so it is important to know the signs and symptoms of breast cancer as a woman. It is not just limited to having a breast lump, and not all breast lumps are cancerous. So, as a woman, if you find a breast lump in your breast, it is important to go and get it checked and find out if it is either cancerous, if it is malignant or not, because there are other benign lumps in women. Other symptoms associated with breast cancer, you have skin changes, nipple retraction. If you find anything odd, really, if you find anything odd about your breast, it is important that you go to a doctor or you go to a health facility to get it checked. And one of the simple methods you can check your breast regularly is doing a breast self examination. I'm sure before the end of this show, Dr. Nurse Feyikemi is going to show us how to do a proper um, self breast examination. There are other modalities that to help diagnose breast cancer in women. You have mammogram for women that are older than 40-year-old. The reason is because when you're less than 40 years old, your breast is still dense, and then an ultrasound might pick up false positive results in women less than 40. So for women older than 40, we prefer that they do mammograms regularly to check for breast cancer and rule out breast cancers in them. But for women less than 40 years old, yes, they can develop breast cancer also. So you do ultrasounds and then other advanced image modalities as your doctor prescribes to screen for breast cancer.
Okay. So of course I know there's no cure for breast cancer, maybe yet, but there's a treatment regimen. Can you run us through what the treatment regimen is?
Okay, so in the treatment of breast cancer, early detection is very important. Early detection of breast cancer gives a 90% survival rate, and many women have been treated and living free of cancer. Are breast cancer survivors today. There are treatment options for breast cancer. You have surgery where the affected breast might be removed. Then you have radiotherapy, you have chemotherapy, you have hormonal therapies, yes, that can be directed and targeted at the breast cancer. And when the breast cancer is limited and has not spread to other parts of the body, it's very easy to contain it and eradicate as much as possible.
So I've heard a lot of, don't do this as regards what causes cancer and what doesn't cause cancer. So let's debunk the myths? I'm sure you've heard a few ones too.
Okay, so for some people, they think that, every woman has to go through whatever it is that a particular patient or somebody has gone through. The truth is, no treatment is the same, and there are different types of breast cancer. So it's really um, patient centered. So it depends on the patient's symptoms and then the type of cancer that the patient is presenting with, the type of breast cancer the patient is presenting with. So there's no treatment that is the same. And I've also heard that some people say that once you treat breast cancer, once it keeps coming back, it is not guaranteed that it will come back. Although in some patients, we've had recurrence in some
Yeah.
patients even after being treated, but that is not it for all patients. Plus, you always want to give it a shot. If you can get treated and be eradicated of the breast cancer, why not give it the shots that it deserves? And breast cancer is not contagious. The fact that somebody has it in the family, even when you have a family history of breast cancer, there are women that do not have family history of breast cancer and still came up with breast cancer. So it is not 100% that if somebody in your family has breast cancer, you definitely will have breast cancer. The only thing that does, the family history helps you with, is you know that you have to go for your regular screening and keep checking to make sure
Yeah.
that you are cancer
Control.
free and get early detection if they ever find one.
Okay. So, are there specific, things that you advise for, every one of us to just work together as regards prevention of breast cancer?
Okay, so in the risk factors of breast cancer, we have modifiable factors and non-modifiable factors. I'll start with the non-modifiable factors, in that family history, genetic mutations, these are things that are beyond our control and they are non-modifiable.
True.
But modifiable risk factors like obesity, like alcohol intake, like unhealthy diet, smoking, these are things that we can deal with and curtail on them to make sure
Yeah.
that we live a healthy lifestyle. Yes, does healthy lifestyle guarantee that you're not going to have breast cancer? No, it doesn't certainly guarantee, but it reduces the possibility of having breast cancer. So one thing we can do to help to reduce this is playing our part, making sure that we live a healthy life. Do not involve, we not do things that encourage the spread of breast cancer. Stop smoking as much as you can. Reduce alcohol intake as much as you can. Exercise and eat healthy food as much as possible.
Okay, so I find life experiences very relatable. I'm sure most people do. When you have someone come up to say, "I've been through this and this is what happened," do you have like a story or, I don't know, something relatable that you can just give us as regards breast cancer, a
Okay.
breast cancer survivor?
Okay, so this is a bit personal to me. I actually have an aunt that was diagnosed with breast cancer, and it was quite a challenging period for her and for us as a family. But one thing that helped us was, she was able to get through to it. With treatment, she had surgery for the affected breast. She also had chemotherapy for. She had a few sessions of chemotherapy. Yeah, chemotherapy was quite, a bit gruesome on her and affected her a bit, but she's fine now. She's been cancer free for a few years now.
Oh, wow. That's stories like this are very encouraging,
Yeah,
and
so
I hope someone out there is encouraged. So maybe because I'm a mental wellness advocate, I feel like the mental support part for breast cancer survivors or those who have been diagnosed to have breast cancer, I feel like the mental wellness part is, it's not well taken care of. And I'll just like for us to, discuss how they can get support, mental support as much as possible.
okay, so mental health is a very important part of breast cancer treatment or diagnosis, because the diagnosis and the treatment of breast cancer can actually take a toll on the mental health of the patients. So it is important to have support system in this period, because the cost implications too can actually take a toll
Yeah.
on the patient. So having support system from your family, your relatives, from your friends, and loved ones in general. Then also finding a support group and joining a support group. You can see people and also meet with survivors to share their story and also encourage you in your fight against breast cancer. And Another thing we can do as a society, as at large, is, as much as possible, that if you can help someone with, with breast cancer, please extend love, extend help, show as much grace as possible. Do not make insensitive statements like, why are you losing weight, why do you look like this, why are you skinny, are
We're
you not
getting
eating,
darker.
why are you getting darker? No, because they are going through a lot, and trust me, they know all of this, but they're just trying to, live every day as it comes and
Yeah.
make the best of it. So no, don't make insensitive statements, whether physically or on social media. And as much as possible, try to lend a helping hand to whoever that is dealing with breast cancer or any cancer in general. I think it's going to be better for us, and improve the society in general.
So you've heard it all. You do not have to go through the fight alone. Speak to someone.
Yeah, and
Speak
if
to your
if you need to,
doctor.
talk to a
Yes,
therapist
speak to
also.
someone. Yes. Don't think you're alone. You're never alone.
At all.
Yeah. So together we can fight breast cancer.
Fighting.
Before wrapping up, we would like to show you how to do a breast self-examination. This examination can be done in the confines of your home, in your bathroom, standing in front of a mirror, and then we just start. So first off, you can stand in front of a mirror where you can see yourself. You want to notice whether there are changes in your breasts,
Yeah.
the size, or
Your nipples.
the
Yeah.
nipples, whether your nipples are inverted or they are going in or
Retracted,
something. You
yes.
just want to see it. After that, so you raise your hand slightly 90 degrees above your head, and then make sure you use your pads, the pads of your fingers, not the tip, and then you go
Outwards,
inwards, checking for unusual textures
Yeah,
and
thickened areas
thickened
and
areas and all that.
lumps,
Do not forget your
armpit.
Then you can also squeeze on your nipples for discharge or any other thing. So if you notice anything while doing this,
Then do the
ensure
same
to
for the
go
other
to the hospital
breast.
or to the nearest clinic. It's possible for you to feel unsure. Sometimes you're just feeling and then you feel like you can feel some things.
Yeah, sometimes, especially when maybe your period is
Yeah.
approaching and then your breast looks dense.
So you can, that way you can also talk to
Just visit a health
person.
facility, and then a doctor or a
And get
nurse
yourself
can
checked.
help you
Yes.
with the examination.
Thank you so much, Dr. Tifek, for coming on this with me.
It's my pleasure.
Thank you for doing justice to everything we need to know about breast cancer.
Yeah.
I'm hopeful that together
Yes.
we'll be our sister's keeper.
Yes.
And together we will do the fight together. So I encourage you to share this video, spread the news, tell your loved ones to get screened, and let's continue the fight against breast cancer together. Thank you.